Assalamu alaikum. This is a new subject for the fifth year level, and the title of this subject is the surgical aids to orthodontic treatments. And this lecture going to be presented by one of the commonly presented patient from our colleague of a specialist in orthodontist or orthodontic. They need surgical exposure of an impacted upper canine. So this is an important part because it is a common. So we are going to discuss a little bit in details. Surgical exposure of impacted canine, upper canine, because it is common, and orthodontic traction of the impacted upper canine. Surgical exposure of the impacted canine by the oral surgeon or any practicing allow this teeth to two choice, either natural eruption or guided by orthodontic treatment. So when you are going to expose the impacted canine, either the tooth erupted naturally or orthodontically guided eruption by the using auxiliaries, and this process need a collaboration or active collaboration between the orthodontist and the surgeon for good planning for this procedure. To have optimal work, we have certain criteria must be fulfilled, and these should be there is an enough space in the arch to accommodate of the tooth. يعني انت تمام سويت exposure فلازم يكون عندك space إلى tooth. If you haven't such a space, you have to regain this space also by orthodontic treatment. There should be an obstructed path of eruption. إذا أنت سويت exposure لازم تعرف إنه ماكو شيء يعيق هذا الeruption، مثلا supernumerary teeth or fibrous tissue or odontome. All these should be removed to prevent such obstruction. After the eruption of the tooth, should be near to the normal position or normal places. يعني انت من يصير عندك eruption لازم تفكر انه هذا التوث يرجع ب normal position all of the level of the present of the tooth. The timing of the procedure، يا وقت احنا نسوي هذا الاكسبوجر should be close as possible as to the normal eruption time، في سبيل الeruption potential يبقى موجود عند البيشنت، لذلك يكون الاكسبوجر دائما قريب على النورمال eruption time. Surgical approaches is by through palatal envelope flap, which extend from the first molar to the first molar when there is bilateral exposure, and from the molar to the molar when there is a unilateral impaction. طبعا التو امباكشن بايلاترال يحتاج accessibility أكبر، فلذلك الاكستنشن مالت الفلاب يكون أكبر، لذلك extended from the first molar to the first molar. As you know, we have two type of impaction, either palatally or labially. First of all, we are going to discuss the palatally positioned canine. What are the procedure or surgical procedure used for the exposure of such an impaction? First of all, called cruciform incision، يعني شكل صليب. إذا تباعون على الصورة اللي موجودة أمامكم، هذا الصورة تشوفونها، هذا الشكل صليب يسموها cruciform incision. After localization of the area of the impacted tooth determined by clinical and radiographic examination. This incision is made over the center of the estimated position of the crown of the tooth. And after the elevation of the flap, we have four-sided flap. لأن هذا تبعون هسه الانسجن الأربعة، إذا رفعناها راح يصير عندنا 4 pieces فيسموها four-sided flap. These four-sided flap elevated to expose the tooth crown, and once completely exposed the flap are excised. يعني بعد أن نسوي exposure إلى التوث, this part of the flap should be excised and removed. هنا تشوفون الصورة الثانية, removal of the bone with the excision of the flap, and this is the tooth exposed, and this is the raw area covered with co-back or rolled gauze after the exposure to apply the auxiliaries for orthodontic treatment. The bone over and surrounding the crown of the tooth is removed in such a way that will be left lying in a saucer-shaped bone cavity. يعني السن يبقى موجود داخل العظم كأنما موجود في داخل معون with short depth, like this image. Without any sharp ridges of the bone at the edges of the tooth, to prevent irregularities in the oral cavity, especially in the palate, which might affect on the speech of the patient. After the exposure of the tooth, a bag is inserted to prevent soft tissue growing over the exposed area. يعني بعدين رفعنا العظم هنا، أحيانا مباشرة يخلون عليها الباند ويسوون traction للتوث، وأحيانا يخلون co-back or rolled gauze for 2 weeks or 10 days to prevent the soft tissue growing over the exposed tooth. This is the first type of incision اللي قلنا هي cruciform incision. The second method for the exposure of the impacted canine is the excision of the overlying mucoperiosteum. Surgical exposure of the palatally impacted canine by excising part of the flap after the removal of the bone and exposing of the tooth. إذا تباعون هنا لهاي الصورة, this is the surgical excision. يسوي surgical exposure, رفع flap, هذا mucoperiosteal flap, شال bone, exposing the tooth, ورجع الفلاب إلى مكانه الصحيح. بعد ذلك you have to excise part of the mucoperiosteal, made a window inside the mucoperiosteal flap. بهالحالة هاي we have two way, either to insert orthodontic band مباشرة directly, or to have to wait for 2 to 3 weeks for epithelialization of the area, then the orthodontist is going to apply their auxiliaries. The other type of impaction which need collaboration between the surgeon and the orthodontist is the buccally or labially positioned impacted upper canine. اللي حكينا بالسلايدات الأولية هو كان الباليتال one. And for the treatment of such condition, surgical exposure of such a condition, it is depending on the depth and the position of the impacted tooth. يعني الامباكتد الموجود على الليبيال سيرفيس قد يكون موجود بالالفيلر ميكوزا، قد يكون بالاتاج ميكوزا، واحيانا out of the bone، فيعتمد على البوزيشن and the depth of the impacted tooth. So any one of the three following famous method used for such a condition. First of all, you have to create a surgical window, يسموه gingivectomy. الطريقة الثانية used a closed eruption technique and apically positioned flap. Three methods usually depending on the depth and the position of the tooth. For buccally impacted teeth are approached by the three-sided buccal flap. يعني usually احنا نسوي three-sided flap. بعد ذلك ممكن نتصرف بأي طريقة أخرى. After the reflection of the mucoperiosteal flap, the crown is exposed in a conservative way to remove the bone, but not to remove the cemento-enamel junction. يعني not to expose the cemento-enamel junction. لقوا بدراسات أو ببحوث علمية إنه لما يسوون exposure للcemento-enamel junction لقوا إنه يصير عندهم external root resorption. In buccal approaches, it is more appropriate to suture the flap over the crown in apically repositioning flap. طبعا هي مو في كل الحالات ترهم الابيكولار repositioning flap، بس لما يكون التوث below the cemento-enamel junction of the adjacent teeth أكثر شيء يستخدمون الابيكولار repositioning flap to cover the tooth and let the other area covered with keratinized. In this slide we are going to discuss in a little bit some detail regarding the gingivectomy or surgical window. If the tooth, impacted tooth اللي قلنا هو labially or buccally, situated just beneath the gingiva, simple excision of the overlying soft tissue is enough to the exposure of the crown. يعني إذا تباعون على هاي الصورة، هذا هو التوث موجود هنا، هذا هو البلجنج، فمجرد أن نسوي gingivectomy للاريا هاي going to expose the crown and then you apply the auxiliaries for orthodontic traction. The surgical window or gingivectomy يعني هذا أو هذا is suggested for labially positioned maxillary canine لما يكون close to the alveolar crest، يعني كلش قريب إلى الالveolar crest، or when there is a broad band of keratinized tissue present. لما أكو keratinized tissue covering the tooth. Implementing the window approach involves the resecting of a mucoperiosteal flap and then repositioning the flap back to the fenestration being opened in the area. يعني نرجع الفلاب إلى المكان اللي بعدين نشيل البون. The tooth may erupt normally once the soft tissue obstructing removed. يعني أكثر الأحيان مجرد أن نشيل هالobstructive بالsoft tissue يصير به eruption. But sometimes we need orthodontic treatment may be required or not required depending on the case, on the clinical follow-up. Gingivectomy procedure is indicated when 1/2 or 2/3 of the crown can be uncovered, leaving at least 3 mm of gingival collar. يعني لما أقدر أشيل نص أو 3/4 gingival tissue من الكيراتينايز tissue وأخلي بحدود 3 ملم gingival collar، ذاك الوقت أقدر أسوي gingivectomy. بس لما يكون بالهاي ليفل ما أقدر أحصل على هذا الشيء، ما أقدر أسوي gingivectomy، إذن أرجع إلى closed for eruption. In most instances, the tip of the impacted tooth is near the cemento-enamel junction of the adjacent tooth. يعني هذا هو الامباكشن وهذا هو cemento-enamel junction وهذا هو البوزيشن of the impaction. وأكو أكو junction between a mucogingival junction between the alveolar mucosa and the attached mucosa. فإذا كان التوث coronal to the this line أكثر الأحيان نسوي لهم gingivectomy. إذا above we have to use the closed method for eruption أو نستخدم الapically repositioning flap. The other method used for exposing the impacted canine labially one is the use of a closed eruption method. And this method is indicated for teeth if it is in the middle of the alveolus. يعني لما يكون الكراون موجود بالmiddle of the alveolus, or near the nasal spine, high level nasal spine, or high level in the vestibule or in the palate. بالنسبة للبلية اللي impacted يعني high level tooth موجود بالالفيولس بالmiddle of the alveolus و near the nasal spine. At that time we are going to elevate a flap, exposing the tooth and exposing the crown. Then after that an orthodontic bracket is bounded to it. يخلون bracket على or band. ويستخدمون traction wire is connected to the bracket. Then the flap is covered over the crown, exposing only the traction wire. إذا تشوفون هنا هذا هو التراكشن واير، أو أحيانا يسموها الجولد تشين، السلسلة الذهبية فقط، بينما الفلاب صاير بيه هيلينج. بعد ذلك وين يربطوها إلى الارش واير ويسوون traction which assist for the exposure or the eruption of the tooth. This method called the closed eruption method تستخدم لما يكون tooth موجود بالهاي level near the nasal spine or بالalveolar mucosa أو بالcrown يكون بالmiddle. The other method used for the exposure of the labially impacted canine is the use of apically repositioning or apically positioning flap. If the cervical part of the crown of the impacted tooth إذا تبعون هنا هذا هو impacted موجود هنا is not within the attached gingiva, removal such a tissue by gingivectomy can lead to the loss of the attached gingiva. يعني إذا رفعنا التشو هذا بطريقة الجنجيفكتومي فمعناته we are going to lose the attached gingiva, and this may create a periodontal problem or effect on the aesthetic of the tooth. تشوفون يصير بيه eruption بس اللينث مال الكراون أكثر من اللينث مال other side. In such condition apically repositioning flap is advisable. والapically repositioning flap إنه يرفعون flap هذا الأوتلاين مال الفلاب ويعملون exposure إلى tooth، بعد ذلك يخيطون الفلاب in apical direction، لذلك يسموها apically repositioning flap. After the elevation of the flap, the crown of the impacted is located, exposed by removal of the bone, and the flap is secured back with apical position so that the crown remain exposed to the oral cavity. يعني اللي باو على الصورة مجرد يباو على الصورة يفهم شنو هي الابيكالي positioning flap. Other condition which need concern with the orthodontic treatment is the presence of the supernumerary teeth, accessory teeth, and these teeth most common in the male than females, and they can be present in the primary dentition and the permanent dentition. And they find that 50% of the primary dentition with supernumerary teeth also associated with the permanent dentition. Supernumerary teeth can be classified according to the position and according to the shape of the teeth. According to the position may be called mesiodense. إذا تبعون هنا هذا present between the two central incisors يسموه mesiodense. It is situated in the premaxilla, in the midline, and is commonly conical. It can be horizontal or inverted or transverse, and can be supplemented teeth, which may also occur in the anterior region. Supplemental يعني tooth تقريبا the same shape of the permanent one. The other one is called paramolar. البارامولر هذولا يتبعين بالصورة هنا، هذا هو يسموه paramolar. appear in the premolar and molar region, and usually present on the buccal side and sometimes on the palatal side, and they may be conical or supplemented in shape. Other type of supernumerary teeth called distomolar أو يسموه الفورث molar. إذا تبعون على هذه الصورة، هذا هو 6، هذا هو 7، هذا هو 8، وهذا هو الفورث molar. هذا يسموه distomolar. Usually distal to the standing molar teeth, and they are either normal or small in size. بس أكثر الأحيان يكون micro tooth. قلنا ممكن نقسمها according to the position or according to the shape. According to the shape, it is either called conical, big shaped. هذا هو البيج shaped conical, or supplementary. هذا هو supplementary، يعني هذا إيش مثل المولر، نفس الشيب نفس السايز تقريبا، which have the shape and the size normal tooth, or they can have a conventional shape with the smaller or larger size. طبعا السوبرنيومراري teeth إذا كانت erupted فالتعامل وياها is very simple by extraction, but sometimes it might present a problem when it is impacted. Supernumerary teeth usually has no effect on the standing teeth in general, but they can cause many effects. First of all, might prevent the eruption of the other teeth and create an orthodontic problem, or crowding, or malposition, or misalignment. هاي كلها problem need treatment before orthodontic treatment, or create an orthodontic problem. Might create a resorption of the teeth adjacent to the tooth, and sometimes be associated with pathology like the cystic lesion. مثل ما قلت لكم قبل شوية، erupted supernumerary teeth are extracted easily if they are conical in shape, but when it is impacted, it means that it needs surgical extraction. The need of the surgical extraction when it is impacted, it needs localization. Where is it present? On the buccal side, on the palatal, in the alveolus between the buccal and the labial. So we can use the buccal object rule اللي سميناها كلارك تكنيك or tube shift technique، أو نستخدم الفيرتكس occlusal view، أو نستخدم الكون بيم CT scan for good accurate localization. For vertical position localization، إذا عرفنا vertical position ممكن نستخدم OBG radiograph determine the vertical position of these teeth, and also study the relation of these teeth, auxiliary teeth, to the nasal cavity and the maxillary sinus. When we decide to remove it surgically, the approach might be palatal or buccal, or sometime combination of the buccal and palatal approach. ونعمل نفس الطريقة اللي نسوي بها surgical removal of the teeth. These two images, in this images, it is a cone beam CT. This is a vertical impression. There is inverted one, and in this area there is a lot of supernumerary transverse section, and studying the relation of the supernumerary relation to the nasal cavity or to the maxillary